Hello, so today we're going to be going over how to fill out the odontogram. So inside of your Axium, as part of step 3 of ODTP, it is expected that you hard tissue chart. So what that means is you want to put in all the current restorative things that your patient has, as well as all the new findings that you have. So once you went through step 3, you've went tooth by tooth and you've decided what they have, it's time to fill it in. So here we're looking at my chart. As you can see, these little greenish blue dots are composite. So on tooth number 2, I have an occlusal composite, tooth number 3, I have an OL, and so on. And where you see the little dots, those are things that are treatment planned, so new composite restorations that need to be done. So I'll break this down into two parts. First, I'll show you how to put in what they currently have, and then I'll show you how to put in new findings. So let's say, for example, we want to put in tooth number 2 composite. We'd click the occlusal surface, if that's what it is, then click on the folder right here, create a new record. Click. Once you go there, you want to click on you have a number of options to look at. There's findings, dental treatment, medical treatment. So what I always do is I click full list, then I click findings, and then materials. And here you can see all the different things that you can put in. So for example, if I had a number 2 endo, you would click endo, click on the little root, and then click add. And there you go, the endo was added. I'm going to delete it so it doesn't affect my chart. Or the same thing you can do with anything. So here, amalgam, composite, gold, implants, porcelain fused to metal crowns. So for example, if I had a number 5 MOD composite, I would click composite. Here's tooth number 5, MOD, click add. And there we go. Now my odontogram has incorporated the number 5 MOD. So you would go through every single tooth and make sure you've done that. So once you've put in all the current findings that the patient has, then you want to put in what new things they have. To do this, you would click on conditions. So for example, here I have tooth number 4. And if I want to say, oh, now it's cavitated, then I would click occlusal codes and I would pick which ICDOS lesion is relevant. So in this case, I'd say, for example, ICDOS 5. I see a cavitation. So I would put that in. And now you can see the little crosses on tooth number 4 occlusal. So when you go back to treatment planning, you're going to know, okay, tooth number 4, I have to decide, should I do a filling? Should I do a crown? Something needs to be there. The other really important reason to put all this in is because it affects the caries risk assessment. The form actually is not accurate until the entire odontogram is filled in. So, as I showed you here, the occlusal codes are what we use for our ICDOS. So if you're seeing any sort of cavitation, lesions, anything like that. With your interproximal codes, you would click aproximal codes. And here it divides into E1 to E's and D's. So you would put in exactly what you see on the x-ray. So just a friendly reminder, if it's touching the DEJ, so where the enamel meets the dentin, you want to go into the D1, D2, D3 codes, which are very common things that you would treat with composite or amalgam or whatever. Versus if it hasn't touched the DEJ, you want to kind of stick to E1, E2, and maybe you can treat it chemically. So the other ones you can see are also facial lingual codes. Those are for your class 5 lesions. And then your general codes. So periapical lesion is an important one if endo needs to be done. So it's the same idea. So if a tooth number 5 has a periapical lesion, click periapical lesion, click tooth number 5 on the root, and click add. So sometimes this system will give you kind of things that you need to do a little differently, and that's fine too. So let me just go back here. Oh, there we go. And so you can put on anything, even things such as overhang, open contact, so things that are wrong in the current teeth, you can put in there also. And then once you have all this information, it's a lot easier to go on to treatment planning because you see all the things the patient already has, all the new findings that you've put in for this patient, and now you can start planning how you want to get it done. Thank you.
that short.
That's a good one, though. The next one will be longer.
We're charging 4 hours of work for that shit?
It's not that short.